this video we are going to talk about the missing nutrient in case of diabetic retinopathy. One of the common complications of uncontrolled diabetes is diabetic retinopathy. It is one of the common causes of blindness, especially in the age group of 30 to 65 years in developed countries. In 20 years, all the type 1 diabetic patient and majority of the type 2 diabetic patient will have some degree of retinopathy. Now, by definition, diabetic retinopathy is considered as a progressive condition. Is there anything that we can do to prevent the progression, to halt the progression before it can cause significant damage to our eyes? New research has pointed out the importance of vitamin A in halting the progression of diabetic retinopathy. What happens when you have high blood sugar constantly is that it damages the retinal blood vessels. It causes inflammation inside the blood vessels of the retina, and it disrupts the intracellular metabolism of the endothelial cells and the pericytes in retina. As a result of that, there is decrease in the vitamin A inside the retina. Now, vitamin A is extremely important for visual cycle because it acts as a precursor to the synthesis of certain proteins which are light sensitive proteins. So for improving the visual function, you must have abundant amount of vitamin A inside your retina. When you have diabetes, the amount of vitamin A inside the retina decreases significantly, and that can affect the visual cycle. So before there are any marked vascular changes inside the retina, most diabetic patients will complain of things like altered color perception, problem with dark adaptation, contrast. So all these signs are your body's way of telling you that you are lacking in vitamin A. So your body is literally screaming for more vitamin A during that period, and it is a sign that you correct vitamin A deficiency during that period before it can cause damage to retina. Because if you do not correct vitamin A and if you do not control the blood sugar, what happens that the chronic inflammation can lead to vascular damage inside the retina, and that can lead to ischemia of the retinal blood vessels and formation of fragile small blood vessels, and these blood vessels are very prone to rupture and they can cause a retinal hemorrhage, so that can lead to blindness. So before all these things can progress, you must focus on vitamin A in order to improve the visual cycle. It's also going to exert an antioxidant effect on the retina because vitamin A is a very efficient antioxidant that can prevent retinal cell from dying early. It can also decrease the degeneration of the retinal cells. So it's going to protect your retina. So all diabetic patient must focus on vitamin A because this is very, very important to prevent diabetic retinopathy. Besides achieving good glycemic control, besides controlling your blood sugar through a healthy diet, through a healthy lifestyle, then sometimes medications. So you want to achieve a good glycemic control. Then it's also important to control your blood pressure, especially if you have diabetes and the target blood pressure is less than 130 by 80 mm of mercury. Then you must correct other risk factors like hyperlipidemia. You must avoid alcohol, smoking. If you are overweight, you must correct all those things in order to prevent progression of diabetic retinopathy. The purpose of making this video is to emphasize on the importance of vitamin A in preventing diabetic retinopathy. So my suggestion to you is that if you have diabetes, go for annual screening for retinopathy, control your blood pressure, control the other risk factor, and take a vitamin A supplement, as well as focus on getting enough vitamin A through a healthy diet. And I would suggest you to take cod liver oil. This is also going to be very, very beneficial for you. And there are other things that you can do to prevent other complications, like diabetes is known to cause neuropathy, so you must get enough vitamin B vitamins, and here avoiding alcohol is extremely important. Then copper and magnesium for neuropathy. In order to prevent diabetic complications like nephropathy, you must take a benfotiamine supplement because this will decrease the formation of advanced glycation end products. So besides achieving a good glycemic control, you must focus on this so that you make your body bulletproof against the negative effect of high blood sugar on your body. If you like this video, consider subscribing to the channel and sharing this video. Thank you.